As a doctor specializing in oncology, I want to warn older adults not to ignore 5 symptoms that appear at night, as they could be signs of cancer. The evening can be the most dangerous time of day, a fact that very few people realize. Because it's precisely when the body relaxes and all the noise of the day fades that the first signs of cancer can appear most clearly. But this is also when they are most easily overlooked. Every year, thousands of older adults discover they have cancer when it is already too late. And the sad thing is, they had seen these symptoms repeat night after night but thought they were normal. Some just thought they were tired due to old age. Some only noticed a little itching at night. Some would sweat so much their clothes were soaked, but they blamed it on the hot weather. So, what are the 5 most dangerous signs at night that cancer quietly sends as a warning? If you recognize them early, it could be the moment that changes your entire life. I invite you to follow along very carefully, because right now I will point out each sign, one by one, without missing any detail. The first dangerous symptom is unexplained itching or rash at night. Itching is a very common reaction that everyone experiences. But if the itch appears at night, isn't caused by mosquito bites, isn't from an allergy, has no clear cause, and especially if it repeats for many days, please do not take it lightly. It could be the first warning sign of blood cancer, liver cancer, or lymphoma. A 68-year-old woman from Ohio once shared her story in a health support group. She said that every night when she lay down, her arms and legs would start to itch relentlessly. The more she scratched, the more it spread. At first, she thought it was the weather, dry skin, or mosquitoes. She tried oils, lotions, and even changed her bedding, but nothing helped. A few weeks later, the itching became more intense, spreading from specific spots to her whole body, accompanied by fatigue and slight weight loss. Her sleep was restless. When she went to the hospital, the doctor ordered liver function tests and a white blood cell count. The results were shocking: early-stage leukemia. Itching, which seems like a simple skin issue, turned out to be a silent alarm from her internal organs. When the liver is damaged, toxins are not filtered out completely. They build up in the blood and stimulate nerve endings under the skin, causing itching. And when the immune system is disrupted, cancer cells grow silently in the blood, also causing a widespread itching reaction. Older adults, who naturally have more sensitive and drier skin, can easily mistake this for common dermatitis and become complacent. Even more frightening, this nighttime itching doesn't just signal cancer. It also acts as a secondary blow, draining your nervous system, causing chronic insomnia, anxiety, and high blood pressure, which can lead to irregular heartbeats and speed up physical decline. For older adults who already have trouble sleeping, adding itching is like turning the night into torture. I hope that those of you who have ever sweat through the night from scratching will seriously reconsider this seemingly harmless sign. Don't let a small symptom become a major tragedy. And if you or a loved one are experiencing a similar situation, it's worth making a personal commitment. Just tell yourself, if I have persistent itching at night, I will get it checked immediately. It's a way to remind yourself and could also help someone else avoid a terrible outcome in time. The second dangerous symptom is a persistent cough that gets worse at night. There's a familiar sound that echoes in the night, not the ticking of a clock, not the steady hum of a fan. It's the sound of a dry, persistent cough, repeating like a sad, endless song. Older adults often think it's just a cough from the weather, a sore throat, or a common cold. But if the cough lasts for more than 2 weeks and is especially worse at night, it could very well be a signal of lung cancer forming silently with every breath. I once witnessed this with a man in his 70s, Jack, a former neighbor of mine in my old neighborhood. He was a quiet, gentle man who had never smoked a cigarette in his life. Yet, he coughed every night. At first, it was a light cough, then it became a dry cough, and then a cough with phlegm. Even when he started seeing specks of blood in his phlegm, he still thought it was probably chronic bronchitis. It was only when he felt chest tightness when lying down and had to sit up at night to breathe more easily that his children took him to the doctor. The result left the whole family stunned. Stage 2 lung cancer that had begun to spread to the lymph nodes in his chest. A nighttime cough is a dangerous sign because it not only disrupts sleep but is also directly related to the respiratory and cardiovascular systems. When lying down, secretions in the bronchial tubes don't drain well, causing more irritation and making the cough worse. People who cough a lot at night are prone to sleep loss, lack of oxygen to the brain, irregular heartbeats, and low blood pressure. For older adults, this can accelerate the risk of stroke, heart failure, and memory loss. Lung cancer is a silent killer. It doesn't cause pain in the early stages and doesn't form a noticeable lump, but it manifests through these seemingly harmless coughs that we often ignore. And by the time it's discovered, it's often too late. I'm telling this story today not to create fear, but to remind you that any symptom at night is more suspicious than during the day. Because that is when the body is not distracted, and abnormalities are more likely to reveal themselves. If you have been coughing continuously at night for many days or weeks, please make a commitment to yourself. Write it down. If I continue to have a persistent cough at night, I will get my lungs checked immediately. One sentence, one action, could save a life, and that is something worth doing right now. The third dangerous symptom is abdominal pain or bloating that lasts into the evening. Abdominal pain is one of the most common symptoms in older adults, but the danger lies in how familiar and easily mistaken it is. And therefore, it's too easily ignored. A dull ache in the lower abdomen, a bit of bloating after the evening meal, a feeling of fullness at the end of the day. Older adults often attribute this to indigestion or a weak stomach and just ignore it. That is a fatal mistake. Carol, a 67-year-old retired teacher, is a classic example. She told me, "I just felt a slight pressure in my lower abdomen every evening. After eating, I'd feel a little bloated, but I thought it was because I was eating a lot of raw vegetables. It was only when I noticed my stool was loose and once saw blood that I started to worry, but I still hesitated to see a doctor. Only when the pain lasted for a whole week and I couldn't lie on my side because of the pressure did I go to the hospital." After a colonoscopy, the doctor was silent for a few minutes and then delivered the news. Early-stage colorectal cancer. If she had waited a few more months, it would have started to spread. Carol's story is not unique. Colorectal cancer and ovarian cancer in women often begin with very vague digestive symptoms. They have a distinct characteristic of becoming more pronounced in the late afternoon and evening. As the body goes through a day of digestion, pressure in the abdomen increases and more food residue accumulates in the colon. Persistent, dull abdominal pain not only warns of cancer, but can also be a sign of chronic inflammatory bowel disease, liver cirrhosis, or pancreatitis. These are extremely dangerous underlying conditions for older adults. If not treated early, they can cause chronic digestive disorders, weight loss, insomnia, osteoporosis due to poor absorption, and overall physical decline. I hope that if you're watching this and have ever felt your stomach ache regularly every evening with bloating or unusual bowel movements, please be vigilant. A recurring pain is, and if you have experienced this symptom, leave a reminder for yourself. I will not be complacent if I have persistent abdominal pain in the evenings. I will get it checked if I notice anything unusual. A small promise can save a life. And who knows, it might just be yours. The fourth dangerous symptom is fatigue and exhaustion in the evening, even without doing heavy work all day. Feeling tired is normal, Everyone feels worn out at times, especially as we age and our physical strength declines. But if a person hasn't done anything strenuous all day, just puttered around the house, yet by the evening, their whole body feels drained, heavy, and their limbs feel like they're weighted down with stones, that is no longer normal fatigue. It could be a silent signal of blood cancer, especially acute leukemia. I once treated a gentleman in his 60s from the Boston area. He told me that in the morning, he would still go to the market, and at noon, he would cook for his wife. But around 5 or 6 p.m., his vision would start to blur. His body would feel limp as if he had lost blood, and he would have to collapse onto the bed, unable to even sleep well. His family thought he was malnourished and gave him multivitamins and expensive supplements, but nothing helped. During a routine checkup, the doctor ordered specialized blood tests. They discovered an abnormal increase in his white blood cell count. He was diagnosed with acute leukemia, an extremely dangerous type of blood cancer if not treated promptly. Blood cancer causes abnormal cells to multiply in the bone marrow, crowding out healthy red blood cells, white blood cells, and platelets. This leaves the body anemic, lacking oxygen, and with a weakened ability to fight infection. The result is unexplained fatigue, paleness, dizziness, shortness of breath, and a rapid heartbeat even without strenuous activity. In the evening, when the body's biological rhythm slows down, these symptoms become even more apparent. This type of fatigue not only warns of cancer, but is also a red flag for people with heart failure, coronary artery disease, an underactive thyroid, or poor liver function. A prolonged state of this can lead to nervous exhaustion, depression, chronic insomnia, low blood pressure, and sudden fainting. This is very dangerous if you live alone. I want to make this clear so you understand. Fatigue is not simply a sign of old age. If your body suddenly crashes every evening and doesn't recover after rest, you must get your blood checked, along with your liver, kidney, and heart function. And if you've ever felt inexplicably exhausted at the end of the day, write a reminder for yourself. I will not ignore unusual fatigue in the evening. I will see a doctor to find out the cause. Because sometimes, your body is trying to warn you before it's too late. The fifth dangerous symptom is unusual night sweats, soaking your clothes and pillow for no reason. Sweating is the body's way of regulating temperature. When it's hot, during strenuous exercise, or after eating spicy food, it's very normal to sweat. But if you're sleeping peacefully in the middle of the night and your body suddenly breaks out in a sweat as if you've just taken a shower, soaking your pajamas and forcing you to change your pillowcase, that is a serious warning sign. I once had a male patient in his 60s who worked as a night cab driver. He didn't smoke, didn't drink, and ate a balanced diet. But recently, he kept waking up in the middle of the night because of his own body. He would be drenched in sweat as if he had just showered, shivering with a racing heart. At first, he thought it was an autonomic nervous system disorder. But when he went for a specialized checkup, his doctor found an abnormal growth in his lymph nodes. He was diagnosed with early-stage lymphoma. Unusual night sweats are one of the characteristic signs of malignant diseases, especially lymphoma, leukemia, or serious endocrine disorders. When cancer cells affect the immune system, the body can no longer properly control its temperature. As a result, during rest, when the biological rhythm should slow down, the core body temperature instead rises. This stimulates the sweat glands to work overtime, causing profuse sweating all over the body without any external cause. It doesn't stop there. This condition also directly affects sleep. Sleep is the golden key that helps an older person's immune system recover. When sleep is constantly interrupted by feeling cold, having to change clothes, and the uncomfortable dampness, the body gradually becomes exhausted. Older adults with prolonged sleep deprivation are very prone to nervous breakdowns, high blood pressure, irregular heartbeats, and even early-onset dementia. Compared to a physical wound, night sweats don't cause pain, but it is an unseen pain. A silent but intense alarm bell that, if not listened to, can result in a tragedy. I hope that from now on, if you find yourself sweating at night for no reason, you will make a commitment. If I have unusual sweats while sleeping, I will get a comprehensive health checkup immediately. Because sometimes, just one time of listening to your body is the time you save yourself. We have just reviewed 5 symptoms that appear at night. These signs seem minor, but they could be the beginning of cancer. And if we are not careful, sometimes just a dry cough, a night of sweating, or a lingering feeling of fatigue can become a slippery slope to irreversible loss. I know many of you still think it's probably just old age. But please don't be complacent. If the body has spoken up many times and we remain silent, there may come a time when there is no chance to correct the consequences. If this video has helped you reevaluate your own health, please press the like button, share it with your loved ones, and leave a comment below. I am ready to listen to my body every night. It is a commitment to yourself. And now I want to ask you something. Is it possible to prevent cancer without medication, hospitals, or expensive treatment plans? The answer is absolutely yes, if we know how to eat right and choose the right foods every day. There are some very ordinary-looking vegetables, spices, or fruits that are actually natural medicines that help the body heal from the inside. And I believe you won't want to miss this. Next, I want to share with you 5 foods that older adults should eat every day to help destroy cancer cells and cleanse the liver, blood, and intestines. The first recommended food is broccoli. Broccoli has long been considered a vegetable shield against many types of cancer, especially lung, colon, and prostate cancer. What makes broccoli so special is a compound called sulforaphane. It's a powerful natural compound that can activate detoxifying enzymes in the liver and destroy cancer cells at the genetic level before they can develop into tumors. Beyond its anti-cancer abilities, broccoli also helps cleanse the blood, reduce bad cholesterol, stabilize blood pressure, and strengthen the immune system. These are all extremely important factors for older adults. However, to get the full benefits, how you prepare it and when you eat it are also very important. You shouldn't boil broccoli for too long, as high heat will destroy the sulforaphane. The best way is to lightly steam it for 3 to 4 minutes or stir-fry it quickly over high heat with olive oil and minced garlic to preserve its green color, crunch, and nutrients. You should eat it at lunch or in the early afternoon when your digestive system is still strong. You can combine it with carrots, bell peppers, or mushrooms to create a stir-fry that supports liver detoxification, cleanses the intestines, and fights constipation. A small note, people taking blood-thinning medication should consult their doctor, as broccoli is high in vitamin K, which can affect the medication's effectiveness. I believe that a plate of broccoli each day is not just a delicious meal, but also a natural shield protecting your liver, intestines, blood, and preventing the formation of cancer cells. If you already eat broccoli, leave a comment below the video. I will eat broccoli the right way to protect my body every day. It's a small promise, but its meaning is immense. The second recommended food is fresh turmeric or turmeric powder. If broccoli is the shield, then turmeric is the warrior that cleans up the battlefield inside your body. Turmeric contains a precious compound called curcumin. Hundreds of studies worldwide have recognized its ability to inhibit the formation and growth of cancer cells, especially in liver, stomach, and colon cancer. Curcumin acts as a powerful anti-inflammatory agent. It prevents cell mutations, slows the growth of blood vessels that feed tumors, and supports the liver in eliminating toxins, cleansing the blood, and regulating the immune system. For older adults who often have a weaker liver, a sensitive stomach, and are prone to chronic inflammation, turmeric is an invaluable natural remedy. However, to get the full effect, you must use it correctly. Fresh turmeric has a slightly strong smell and a mild, spicy taste, suitable for use in stews or mixed with warm water to drink in the morning on an empty stomach. It's best to add a little black pepper and coconut oil to increase curcumin absorption. For those who can't handle fresh turmeric, you can use pure turmeric powder mixed with unsweetened warm milk or pure honey. A suitable dose for older adults is 1/2 to 1 teaspoon per day. Don't overdo it, as it can cause heat or stomach irritation if you use too much. Besides its anti-cancer properties, turmeric also helps reduce joint pain, heal stomach ulcers, improve memory, and stabilize blood sugar. These are all common issues that older adults often face. If you have ever had turmeric tea or used turmeric in your meals, please leave a comment below. I will use turmeric correctly every day to prevent cancer and protect my liver. A small spoonful of turmeric each day can make a big difference in your health as you age. The third recommended food is raw garlic. Garlic has long been considered one of the most powerful natural antibiotics in the plant world. But what many people don't know is that garlic contains an incredibly valuable compound called allicin. This substance has the ability to inhibit the growth of cancer cells and is particularly effective against stomach, colorectal, esophageal, and lung cancers. Allicin doesn't exist readily in a clove of garlic. It is only formed when garlic is crushed or chopped and left exposed to the air for about 10 to 15 minutes. During that time, the enzyme alliinase reacts to create allicin, which is the soul that helps garlic become a cancer-fighting warrior. In addition to its anti-cancer benefits, garlic also helps cleanse the blood, lower blood pressure, reduce bad cholesterol, stabilize blood sugar, and boost immunity. These are benefits that are especially necessary for older adults who are dealing with multiple health issues at once. The most effective way to use it is to eat raw garlic that has been crushed and left to sit for a few minutes. You can eat raw garlic with rice, steamed vegetables, or pickled. But be aware, you should only have 1 or 2 cloves per day, and avoid eating it on an empty stomach or if you have severe stomach ulcers. If you can't eat raw garlic, you can use garlic soaked in honey, which is easier to eat and good for the respiratory system. Additionally, fermented black garlic is an excellent choice for older adults as it has less odor, is easier to digest, and still retains its anti-cancer properties. Whatever its form, garlic remains a reliable defense wall for the body. If you have ever eaten raw garlic or are using garlic to protect your health, please leave a commitment below the video. I will use garlic correctly every day to cleanse my blood and prevent cancer. Sometimes, just 1 small clove of garlic can be the greatest savior for our bodies. The fourth recommended food is well-cooked tomatoes. Tomatoes are a common, inexpensive fruit, but if understood and used correctly, they are an incredibly effective red shield against cancer. The component that makes tomatoes so valuable is lycopene. It's a powerful antioxidant that can neutralize free radicals, prevent DNA damage, and slow the growth of cancer cells. Interestingly, lycopene is not very active in raw tomatoes. Instead, it becomes most effective when tomatoes are cooked. Therefore, you should use tomatoes in stews, stir-fries, soups, or well-cooked sauces. It's especially good to cook them with a little healthy oil like olive or sesame oil, as lycopene is fat-soluble. Eating cooked tomatoes regularly every day helps reduce the risk of prostate cancer in men and cervical cancer in women. It also supports the liver in detoxifying, improves cardiovascular function, lowers blood pressure, and protects vision. These are all issues that older adults are very prone to. A simple suggestion is to prepare 1 meal a day with cooked tomatoes. This could be tomato egg drop soup, tomatoes stir-fried with squash, or cooked with fish or tofu. You shouldn't eat unripe tomatoes because they contain solanine, a substance that can cause digestive upset if it accumulates. A small note for those with stomach problems: eat tomatoes after a main meal and choose naturally ripe, red tomatoes that are not bruised or overly sour. If you've been eating tomatoes daily but haven't paid attention to how to prepare them to maximize their benefits, today is the time to adjust. And if you feel you now understand more about the power of this fruit, leave a comment below. I will eat well-cooked tomatoes every day to prevent illness and live healthier. Just by adding one tomato to your meal, you are adding a layer of armor for your liver, your heart, and your entire body. The fifth recommended food is blueberries and other dark-colored berries. They are small and soft, but they possess an incredibly impressive power to fight cancer. This is the group of dark purple and black berries like blueberries, blackcurrants, blackberries, and mulberries. These fruits contain high levels of anthocyanins. This is a powerful antioxidant that helps prevent cell damage, inhibit tumor formation, and slow the spread of cancer, especially blood, liver, and breast cancer. But it doesn't stop there. Anthocyanins also help cleanse blood vessels, enhance memory, prevent neurological aging, and improve vision. These are all things that older adults desperately need to maintain their quality of life. The best way to consume them is to eat them fresh in the morning or mid-afternoon, about 100 to 150 grams per day. If fresh blueberries are not available, you can choose unsweetened frozen blueberries or pure juice, but be sure to read the ingredients carefully to avoid those with artificial colors and industrial sugar. You can also combine blueberries with unsweetened yogurt, oatmeal, or chia seeds to create a nutritious snack that's good for your heart, digestion, and immune system. Another plus is that these fruits have a low glycemic index, making them very suitable for older adults with diabetes, high blood pressure, fatty liver, or high cholesterol. These are underlying diseases that often come with a higher risk of cancer. With their attractive color, light sweetness, and countless benefits, blueberries and other berries truly deserve to be called natural medicine from fruit. If you are surprised by the benefits of this group of fruits, please leave a comment below the video. I will eat blueberries and berries every day to protect my blood, brain, and liver. Because sometimes, just a small cup a day is what nurtures a long and healthy life within you. Do you regularly eat the types of foods I just shared? If the answer is yes, then congratulations. You hold in your hands some of the most precious natural medicines to help prevent cancer cells, detoxify your liver, purify your blood, and protect your entire body. And if you haven't paid attention or rarely eaten them before, today is the opportunity to start a new habit. A right step to live healthier and longer every day. Because sometimes the difference between illness and well-being lies not in medicine, but in the choices we make at our meals. If you found this video helpful, please click the like button, share it with your loved ones, and leave a comment about which food you are most excited about to spread the value of health to more people. And now I ask, even with a careful diet, why do some people still get diagnosed with cancer late, sometimes when it's already too late? The answer lies in the mistakes that seem harmless, but are extremely dangerous, which many older adults are making every day. Right now, I will reveal to you the 5 mistakes older adults make that lead to a late cancer diagnosis and also damage the liver, weaken the kidneys, and harm the bones and joints. Don't miss it, because who knows, just one small mistake could be silently destroying your own health. The first harmful mistake is self-medicating with fever reducers or cough suppressants for a prolonged period without knowing the cause. In older adults, the common cold, a mild fever, or a nagging cough are very common conditions. And because they are so familiar, many people go to the pharmacy themselves to buy a few fever reducers, anti-inflammatories, or cough syrups. They think simply, a few doses will make it better. It's not worth going to the hospital. This very action leads to one of the most dangerous mistakes, masking the symptoms of cancer with medication, allowing the disease to develop silently behind a facade of feeling better. Many types of cancer, especially lung cancer, lymphoma, or leukemia, often begin with very mild symptoms. These include a low-grade fever in the evening, a persistent cough that won't go away, a feeling of chills or night sweats. If these signs are temporarily suppressed by anti-inflammatory drugs or fever reducers without treating the root cause, it means the body's initial warning has been muffled. Meanwhile, the disease continues to grow inside. The consequences don't stop there. Long-term use of over-the-counter drugs can also severely damage the liver and kidneys. These are the two organs primarily responsible for filtering toxins and metabolizing drugs. In older adults whose liver and kidneys are already weaker, forcing them to work overtime can easily lead to acute liver failure, kidney inflammation, or digestive disorders and osteoporosis from the overuse of corticosteroids. The most important thing is not what to take to get better quickly, but to know exactly what you are dealing with before you put any medication into your body. If you have a habit of buying your own medicine when you have a fever or a persistent cough, leave a reminder for yourself below the video. From now on, I will not self-medicate if I don't know the clear cause. Because the caution you take today may be the reason you are healthier tomorrow. The second harmful mistake is considering fatigue a normal part of aging and skipping specialized checkups. In your 60s or 70s, feeling a tired back, heavy legs, or the desire to lie down at the end of the day is common. And because of this, many older adults reassure themselves that I'm old, being tired is normal. And so they silently endure it, day after day, until they discover their body has collapsed for no clear reason. This is one of the most dangerous traps that many people fall into. Because prolonged fatigue, especially in the late afternoon and evening, even when you haven't done any heavy work or exerted yourself, yet you still feel completely drained and exhausted and can't sleep deeply, could be an early sign of blood cancer, liver cancer, or bone marrow failure. That is when your body is being drained of energy by abnormal cells growing silently inside. This reduces red blood cells, causing anemia and a lack of oxygen, making the person increasingly pale and weak without a clear explanation. If this condition is not detected early, it not only makes cancer treatment more difficult, but also severely affects memory, the cardiovascular system, bones and joints, and the entire immune system. This can push the body into a downward spiral of complete exhaustion. What's worth noting is that many people see a doctor very late, only when they have lost weight, have no appetite, or are too tired to even walk. Meanwhile, with just a single blood test, a check of liver enzymes, and a general ultrasound, many diseases can be detected very early and treated effectively. I hope that after hearing this, you will no longer take unexplained fatigue lightly. If you used to think fatigue was just due to old age, leave a comment below the video. From now on, I will get checked immediately if I feel unusually tired. Because who knows, just one proactive checkup could be your chance to hold on to your health and your life. The third harmful mistake is only applying topical creams for nighttime itching without checking liver function or getting a blood test. Itching is a very common symptom, especially in older adults with dry skin, changing weather, or insect bites, all of which can cause it. So, when they feel an itch in the evening, especially when resting, many people immediately think of allergies. They then go to the pharmacy themselves to buy topical creams, anti-itch lotions, or use folk remedies. But what few suspect is that persistent nighttime itching with no clear cause and no response to topical creams could be an early sign of serious medical conditions. These include liver cancer, lymphoma, leukemia, or immune system disorders. When liver function declines, toxins are not eliminated promptly and accumulate in the blood. This stimulates nerve endings under the skin, causing a full-body itching sensation that is especially worse at night when the liver is most active. If you only focus on treating the surface of the skin while the root of the problem lies deep within your internal organs, it's like putting out the flames on top while the embers smolder inside. Even worse, overusing topical creams containing corticosteroids can thin the skin, weaken the skin's immunity, and worsen underlying medical conditions. All while the abnormal liver and white blood cell counts are dangerously overlooked. My advice to you is that if you feel a persistent itch at night that spreads across your body for no clear reason, don't just apply cream. Ask your doctor to check your liver function, order a complete blood count, and get an abdominal ultrasound to rule out dangerous causes. If you have ever been complacent about those nagging itches, leave a reminder for yourself below this video. I will get my liver and blood checked if I have persistent nighttime itching. Because the caution you take today could be the reason for a healthier and more peaceful tomorrow. The fourth harmful mistake is having poor sleep and prolonged exhaustion, but not getting regular blood tests. Sleep is the foundation of health, especially for older adults. However, many people toss and turn, wake up in the middle of the night, and still feel exhausted upon waking. And then they console themselves, thinking, it's just old age, everyone sleeps a little less. This mindset causes many people to miss the subtle signs of dangerous diseases, especially those related to the blood, thyroid, or immune disorders. In many cases, blood cancers, especially chronic leukemia, show no clear symptoms other than poor sleep, sluggishness, dizziness, and mild heart palpitations at night. The cancer cells in the bone marrow silently overwhelm the healthy bloodlines. This causes red blood cells to decrease, so not enough oxygen is supplied to the brain and heart. This leads to light sleep, frequent awakenings, and a racing heart even when lying still. However, very few people think of getting a blood test just because they aren't sleeping well. They turn to sleeping pills, herbal teas, or folk remedies. And all the while, the abnormal cells continue to multiply every day. It's not just about cancer. Prolonged insomnia is also an early sign of an underactive thyroid, coronary artery disease, chronic hepatitis, or systemic chronic inflammation. All of these need to be detected early through specialized blood tests. Therefore, if you feel you are not sleeping deeply and feel drained despite not working hard, don't rush to take sleeping pills. What you need to do is get a complete blood count, check your liver enzymes, inflammatory markers, and cardiovascular function. If you have ever downplayed unusual insomnia, please leave a reminder below this video. I will get my blood checked if I have prolonged insomnia without a clear reason. Because sometimes, sleep is not just about rest, it's also the clearest mirror reflecting the condition inside your body. The fifth harmful mistake is ignoring evening symptoms like coughing, bloating, or sweating and just letting them pass. In the rhythm of daily life, especially for older adults, feelings like a slight cough at night, a bit of bloating after dinner, or a little sweat on your shirt in the middle of the night are often dismissed as trivial matters. Some think it's due to something they ate, some blame the weather, and most just ignore it. They don't record it, they don't monitor it, and they don't see a doctor. This disregard and neglect is the most dangerous loophole that causes many people to discover cancer when it is already in a late stage. Because unlike intense pain, early-stage cancer often only manifests with very mild symptoms that appear repeatedly in the evening. This is when the body begins to relax and the internal organs become more active again. A cough that seems harmless, but if it lasts for 2 to 3 weeks, especially if it's worse at night, could be a sign of lung cancer. A little abdominal bloating after the evening meal, if accompanied by unusual stools, could be an early warning of colorectal cancer. And those sweats that drench your back in the middle of the night, even when it's not hot, are a classic sign of lymphoma or an immune disorder. The problem is that older adults often don't record these symptoms. They don't compare the frequency, and they don't share it with their children. By the time the symptoms become obvious, it's already too late. I advise you to prepare a small notebook or ask a family member to help you jot down these nighttime symptoms. The more detail, the easier it will be for a doctor to make an accurate assessment. And if you have ever had the mindset of, it's probably nothing, please leave a commitment below this video. I will not ignore recurring evening symptoms anymore. Because sometimes, the thing that seems smallest is actually the biggest warning from your body. My dear friends, after going through the 5 dangerous mistakes that cause many people to discover cancer too late, I hope that from now on, you will no longer stay silent about any unusual signs, no matter how small. Because health is something that never speaks up clearly, it only whispers. The sooner we listen, the greater our chance of preserving life. Life is already full of worries. Don't let complacency about your health add wordless regrets. If you feel today's sharing was valuable, please press the like button on the video, share it with friends and family, and comment below which mistaken habit made you realize something, so we can learn and improve together. And now I want to ask something very simple. If it only takes a few minutes each evening, costs no money, requires no medicine, and you could strengthen your liver and kidneys, prevent cancer, and sleep more deeply, would you want to try it? Right now, I'm going to share with you 4 simple evening habits for older adults to prevent cancer, keep their liver healthy, sleep well, and help their body recover. These are not complicated methods, but small things. But if done regularly, they will become a silent but extremely effective shield, helping you live healthily, happily, and longer, day by day. The first simple habit is to turn off your phone and other light-emitting devices at least 30 minutes before bed. In today's era, phones, TVs, and tablets have become an indispensable part of life. Young people use them for work, while older adults use them to read news, listen to music, or video call their children and grandchildren. However, what very few people notice is that the blue light emitted from electronic devices can seriously disrupt the body's natural sleep cycle. Science has proven that blue light from screens suppresses the production of melatonin. This is the hormone that helps the body feel sleepy, regulates our biological clock, and strengthens the immune system. When melatonin is blocked, older adults will find it hard to fall asleep, have fitful sleep, wake up easily in the middle of the night, and most importantly, miss out on the deep sleep stage. This is the stage where the body recovers and repairs damaged cells. And if the body doesn't get deep sleep every night, the immune system weakens over time. Toxins accumulate in the liver and kidneys because they are not eliminated on schedule. This makes the risk of hormonal imbalance, chronic inflammation, and cell mutations leading to cancer much more likely. Therefore, a simple but extremely important piece of advice is to turn off all phones, TVs, and bright screens at least 30 minutes before going to bed. Instead, you can meditate, listen to soft music, read a physical book, or simply take deep breaths in a quiet space. Just one small change can help you sleep more deeply, wake up feeling more refreshed, and importantly, give your body back its natural power to heal. If you agree, please leave a comment. I will turn off electronic devices before bed to protect my sleep and my health. 1 minute of turning off your device means a full night of sleep, and that is the greatest gift you can give yourself. The second simple habit is to drink a small glass of warm water before bed. Water may seem ordinary, but it is the key to preserving life for every organ in the body, especially in older adults. And, surprisingly, just one small glass of warm water, about 5 ounces, drunk 30 minutes before bed, can bring many unexpected benefits for the liver, kidneys, heart, and immune system. While you sleep, your body is still silently working. The liver detoxifies, the kidneys filter blood, the heart pumps steadily, and the brain repairs cellular damage. If you are dehydrated, this process becomes sluggish. The blood thickens, circulation slows, and this can easily lead to high blood pressure at night, chest pain, stroke, or heart failure. This is especially dangerous for older adults who already have underlying health conditions. Drinking warm water, not cold water, before bed also helps to soothe the nerves, gently relax the muscles, aid digestion, reduce stomach acid, and prevent constipation. At the same time, it helps the liver work more smoothly in its detoxification process. Additionally, the warm temperature of the water creates a feeling of relaxation, making it easier to fall asleep. However, the important thing is not to drink too much to avoid waking up multiple times to urinate at night. A moderate amount of about 5 ounces is ideal. It will help balance your internal environment without disrupting your sleep. You can add a few thin slices of ginger, a sprig of mint, or a little honey to your water to enhance the effect of warming your internal organs. This is especially good for people who often have cold hands and feet, insomnia, or aches and pains at night. If you find this habit simple and useful, please leave a comment below. I will drink warm water before bed so my liver and kidneys can detoxify and I can sleep more deeply each night. Just one small glass of water, but it's enough for your whole body to thank you all night long. The third simple habit is to take 10 deep breaths before bed to calm the nerves and restore the immune system. We often think of breathing as a natural act, nothing special. But the truth is, the way you breathe correctly before bed can have a profound impact on your nervous system, cardiovascular system, endocrine system, and immune system, especially in older adults. In the evening, if you take about 2 to 3 minutes to sit quietly on your bed or the edge of it, close your eyes, place a hand on your belly, and inhale very slowly through your nose for a count of 4. Hold your breath for 2 seconds, then exhale gently through your mouth for a count of 6. Repeat this about 10 times, and you will immediately feel a clear change. Your body calms down, your heart rate becomes more regular, and your mind settles. This small habit helps activate the parasympathetic nervous system. This is the system responsible for putting the body into a state of rest and recovery. When that happens, blood pressure gently drops, blood vessels relax, and circulation improves. And especially, it calms the neuroendocrine immune axis, preventing the silent inflammatory reactions that can lead to cell mutations, thereby reducing the risk of cancer. In addition, deep breathing helps bring more oxygen into the blood, which is essential for older adults who are often tired, have trouble sleeping, feel weak, or have heart, liver, or kidney disease. This is also a gentle way to temporarily disconnect from the day's worries, bringing your mind back to a state of balance, ready for a deep sleep. You don't need any complicated techniques. Just inhale very slowly, exhale very evenly, and focus on your own breath. If you feel this habit is easy to adopt, please comment below the video. I will practice deep breathing every night for a calm mind, good sleep, and a restored body. Just 10 slow breaths, but they can nurture a healthy body for a lifetime. The fourth simple habit is to write down 3 things you are grateful for or small joys from the day. This nourishes the mind, calms the spirit, and boosts immunity. As we age, many older adults can fall into a state of emptiness, anxiety, or even sadness because they feel they no longer have a role in the family. And it's precisely these silent emotions that are the invisible trigger that weakens the immune system, disrupts hormones, increases the risk of chronic inflammation, and damages cells. These are all factors that can pave the way for cancer. In fact, one of the simplest yet most effective mental remedies lies in a pen and a piece of paper. Before going to bed, just write down 3 things that made you feel grateful or happy during the day. It can be something as small as a delicious meal, a phone call from a grandchild, or a cool breeze on the porch. Science calls this gratitude journaling. Many studies show that maintaining this habit every night helps reduce levels of the stress hormone cortisol. It also increases the production of serotonin and endorphins, 2 natural chemicals that help relax the mind, make it easier to sleep, and help the immune system function better. When the mind is lit up with positive things, the nervous system automatically shifts into a state of safety. This helps sleep come faster and deeper, and the process of repairing damaged cells happens more effectively. You don't need to write a lot, and you don't need to write well. What's important is to be honest with your feelings and give yourself a moment of stillness each night. If you want to start this habit today, please leave a reminder below the video. I will write down 3 things I'm grateful for each night to have a light heart, deep sleep, and a happier life. Just a few words, but they can help you reawaken a strength that has been sleeping inside of you. My dear friends, we have gone through 4 simple but powerful habits, from turning off electronic devices, drinking a glass of warm water, and breathing deeply, to writing down things we are grateful for. Each one only takes a few minutes, costs no money, and requires no special skill. But if you maintain them regularly every night, your body will gradually recover, your mind will become peaceful, your liver and kidneys will be healthier, and your immune system will become stronger than ever. In a world with increasing pressure, sometimes it is simplicity and gentleness that are the silent miracles protecting you from dangerous diseases, including cancer. If you found this video helpful, please click the like button, share it with family and friends who also need a reminder about their health. And don't forget to comment below what you will start doing from tonight to keep your own promise and inspire others. Thank you for staying with me until the end of the video. I look forward to seeing you in the next share on our channel, where we learn together to preserve our health, our peace, and live each day more serenely.